If you've been more tired than usual lately, if your ankles look a little puffier by the end of the day, or if you've noticed something's changed about your bathroom habits, you may already be looking at the earliest warning signs of kidney disease and not know it. 9 out of 10 people with kidney damage have no idea it's happening. Not because the body stays silent. It doesn't. It's because these signs don't look like a kidney problem. They look like being busy, getting older, not sleeping well, eating a little less than usual. Each one, on its own, seems too small to mention to a doctor. But your kidneys filter about 150 quarts of blood every single day. When that filtering starts to slip, your whole body feels it long before a lab test ever catches it. By the end of this video, you'll know exactly what those 9 signs look like in real life, and which ones you should never wave off again. Some of them show up in the bathroom, some show up at the dinner table, one of them shows up in the mirror, and most people never connect it to their kidneys at all. Stay with me through all 9, in order, because they build on each other, and the last few often make sense of the ones you've already dismissed. Here's something most people never hear from a doctor until it's already a problem. Kidney disease has been called a silent condition for a reason. And that reason isn't reassuring. It's the opposite. The kidneys can lose a significant amount of function while blood tests still come back looking fine, which means the body often starts sending its own signals long before a diagnosis does. If you've ever mentioned feeling unusually tired to a doctor and been told it's probably stress, or noticed swelling in your feet and blamed it on standing too long, you're not imagining things, and you're not overreacting. You're picking up on real signals. You just haven't had a reason to connect them yet. That's what this video is for. Not to alarm you and not to diagnose you, only your doctor can do that, but to hand you the list that most people only get after a diagnosis, so you can catch these signs while they're still just whispers, instead of waiting for them to become something louder. We're going in order, from the signs people notice first, to the ones that tend to show up as things progress. Stick with all 9, because it's often sign 6 or 7 that finally makes everything else click into place. And if you're watching this because a doctor's disappointment left you with more questions than answers, or because a parent or spouse has been quietly waving off symptoms for months, you're exactly who this video is for. Kidney disease affects an enormous number of adults, and the overwhelming majority of them have no idea it's happening. Not because they weren't paying attention, but because nobody ever handed them a plain language list like the one you're about to get. That's the gap we're closing today. One sign at a time, in plain language, without the jargon that usually makes this topic feel more intimidating than it needs to be. This is almost always the first sign, and it's also the easiest one to explain away. Your kidneys do more than filter waste. They also produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. When kidney function starts to decline, erythropoietin production drops, red blood cell production slows down, and the result is a mild, creeping anemia. Not the kind that knocks you flat, but the kind that makes a full night's sleep feel like it didn't count for much. On top of that, when the kidneys aren't clearing waste products efficiently, those toxins build up in the bloodstream and add a kind of low-grade fog to everything you do. You might notice you're the one asking to sit down halfway through a walk you used to finish easily, or that afternoons hit you harder than they used to. But here's what most people don't know. This fatigue often shows up gradually, over months, which is exactly why it gets attributed to aging, poor sleep, or stress instead of anything physical. It's rarely dramatic. Nobody wakes up one morning unable to get out of bed. Instead, it's a slow subtraction. The garden that used to take an hour now takes 2. The grandkids' visit that used to energize you now leaves you needing a nap. The errands you used to run back to back now get spread across 2 trips because the second half of the day just isn't a rise, because it creeps in this gradually. Most people adjust their lives around it instead of questioning it, which is exactly how a real physical change hides in plain sight for months or even years. Almost nobody realizes that fatigue and sleep problems can show up together as related kidney signs rather than one simply causing the other. When kidney function declines, Toxins that would normally be filtered out can build up in the blood, and this buildup has been linked to disrupted sleep patterns and restless legs at night. So you end up in a frustrating loop, tired during the day, but not actually sleeping well at night either. If you've caught yourself wide awake at 2 a.m. for no clear reason, or dealing with an uncomfortable, hard-to-describe restlessness in your legs right as you're trying to fall asleep, that's worth mentioning to your doctor, especially alongside daytime fatigue. Individually, tiredness and poor sleep feel like ordinary complaints. Together, especially in someone over 50 with high blood pressure or diabetes, they start to form a pattern worth paying attention to. It's worth saying clearly, plenty of things disrupt sleep that have nothing to do with the kidneys. Stress, caffeine, an uncomfortable mattress, another medical condition entirely. The point isn't to assume the worst from one restless night. The point is to stop treating months of unexplained daytime exhaustion and nighttime restlessness as two unrelated coincidences, especially if you already have a risk factor like diabetes or high blood pressure sitting quietly in your medical history. And that pattern becomes even easier to spot once you notice which is exactly where the next two signs show up. Here's where it gets interesting, because this is one of the most direct signals your kidneys can send, and one of the most commonly dismissed. The kidneys are responsible for regulating how much urine your body produces and how concentrated it is. When their filtering ability changes, so does your urination pattern. That might mean needing to go more often, especially at night, in a way that's new for you. It might mean smaller amounts more frequently, or noticeably less urine overall despite drinking the same amount of fluid as always. Waking up 2 or 3 times a night to use the bathroom, when that never used to happen, is a change worth tracking rather than brushing off as just part of getting older. It's easy to see why this one gets missed. Bathroom habits are personal, a little uncomfortable to bring up, and they shift for all kinds of reasons that have nothing to do with kidney health, from caffeine intake to certain medications to an enlarged prostate in men. That's exactly why the useful move here isn't panic, it's tracking. Has the pattern actually changed from what's normal for you, and has it stayed changed for more than a week or two? That distinction, a new persistent pattern versus a one-off night after too much coffee, is stas, what turns a vague impression into something concrete enough to describe to a doctor. There's one detail most people miss entirely, because it happens in a matter of seconds, and then it's gone. Healthy kidneys are supposed to keep protein inside your bloodstream, filtering out waste while holding on to the things your body still needs. When the kidney's filtering units are damaged, protein can start leaking into the urine, and that protein creates foam, persistent, small bubbled foam that looks similar to what you'd see whisking eggs, and that doesn't disappear quickly the way ordinary bathroom bubbles do. Occasional foam from a fast stream is normal. Foam that shows up consistently, every time, is not something to explain away. If you've noticed this and dismissed it because it felt like an awkward thing to bring up with a doctor, you're far from alone, but it's exactly the kind of detail worth mentioning at your next appointment. A simple way to tell the difference. Forceful stream foam from urinating quickly usually clears within a few seconds, the way bubbles on top of a freshly poured soda settle. Foam tied to protein in the urine tends to sit there, dense and fine-bubbled, well after the bowl has gone still. It's a small, almost embarrassing detail to bring up out loud, which is exactly why so many people quietly notice it, say nothing, and let months go by before it ever comes up at an appointment. And once fluid balance starts shifting inside the body, it doesn't just affect the bathroom. It starts to show up on the outside too, which brings us to a sign most people notice in the mirror before they ever connect it to their kidneys. What researchers found next was unexpected to most patients, even though the mechanism is fairly simple once it's explained. When kidney function drops, the body has a harder time clearing excess sodium, and sodium holds onto water. That extra fluid doesn't stay in the bloodstream, it settles into tissue, pulled by gravity toward the lowest points of the body. For most people, that means the feet and ankles first, especially by the end of the day, after hours of sitting or standing. You might notice your socks leaving a deeper indent than usual, or shoes fitting tighter in the evening than they did in the morning. This kind of swelling can have other causes too, including heart or liver issues, which is exactly why it's worth having checked rather than guessed at. One simple way people notice it without even trying to check: pressing a fingertip gently into the front of the shin for a few seconds and watching whether a slight indentation lingers afterward. It sounds minor, almost too simple to mean anything, which is precisely why it gets dismissed as just tired feet instead of what it might actually be: a fluid balance signal coming from an organ nowhere near the ankle. This next one catches almost everyone off guard because it seems completely unrelated to anything happening with the kidneys, but it comes from the exact same protein leak mechanism described a few minutes ago. When protein escapes into the urine instead of staying in the bloodstream, the body has a harder time keeping fluid inside the blood vessels where it belongs, and that fluid can gather in areas with looser tissue, including around the eyes. That's why this puffiness often shows up first thing in the morning, sometimes fading somewhat by afternoon, and it's frequently mistaken for poor sleep, allergies, or simply getting older. If it's a new pattern, and especially if it's showing up alongside the swelling from sign 5, it deserves more than a concealer stick and a shrug. What makes this sign genuinely useful is timing. Allergy-related puffiness tends to come with itching, redness, or a clear seasonal trigger, while poor sleep puffiness usually fades within an hour of waking. Kidney-related puffiness tends to be persistent, painless, and shows up on a schedule that has nothing to do with pollen counts or how many hours you slept, which is exactly the kind of detail that's easy to notice once you know to look for it, and easy to miss when you don't. It's worth pausing here to notice something. None of these first 6 signs involve pain. That's part of what makes kidney disease so easy to miss. There's no sharp signal telling you something's wrong, only these quiet shifts in energy, sleep, bathroom habits, and how your body holds on to fluid. Now, fluid isn't the only thing that changes when kidney function declines. Appetite and how the food tastes change too, and that's where 2 of the most overlooked signs are hiding. The surprising part is how directly this connects back to the same waste buildup we talked about with fatigue. As waste products accumulate in the blood, they can affect taste perception and appetite regulation, leaving food seem less appealing, or giving meals a persistent metallic or ammonia-like taste that wasn't there before. Some people notice they're simply eating less without deciding to, or that foods they used to enjoy now taste faintly off in a way that's hard to describe to anyone else. Unexplained, gradual weight loss can follow, not from an intentional diet, but from steadily eating less over weeks or months. If a family member has commented that you've been eating differently lately, or you've noticed meals just don't interest you the way they used to, that's worth raising with your doctor, particularly alongside any of the earlier signs. This one tends to sneak up sideways. You're not consciously deciding to skip meals or cut portions. You just find yourself less interested in food than you used to be, or reaching for a metallic-tasting glass of water that somehow never quite satisfies. Because it doesn't feel like a symptom, it feels like a mood. It's one of the easier signs on this list to overlook entirely, even when it's been going on for weeks. Almost nobody connects nighttime leg cramps to kidney health, but the kidneys play a central role in regulating electrolytes, sodium, potassium, and calcium, that keep muscles firing correctly. When kidney function declines, these electrolyte levels can drift out of balance, and one of the most common results is sudden, sharp muscle cramping, often in the calves, often striking at night when you're finally trying to rest. If you've been waking up to a cramp so intense it takes your breath away, and you've chalked it up to dehydration or getting older, that's comes as reasonable first guess, but it's worth mentioning to a doctor if it's becoming a regular occurrence, especially alongside changes in urination or ongoing fatigue. These cramps also tend to be more intense and more disruptive than the occasional cramp anyone might get after an unusually active day, and they often strike the same muscle group repeatedly rather than moving around at random. If you started keeping a mental note of how many nights this month a cramp has jolted you awake, that mental tally is worth turning into an actual conversation with your doctor. There's one more sign left, and it's the one hiding in plain sight on the surface of your skin. Here's what most people don't know about this last sign. Your skin isn't just reacting to dry air or aging, it can be reflecting an internal imbalance. Healthy kidneys help maintain the right balance of minerals in your blood, including calcium and phosphorus. When that balance is disrupted, it can trigger persistent, hard-to-relieve itching and unusually dry skin, sometimes across the whole body rather than in one spot. Lotion might help temporarily, but the itch tends to return because the cause isn't on the surface, it's underneath it. On its own, dry or itchy skin is common and usually harmless, especially with age or in dry climates. But paired with fatigue, swelling, or changes in urination, it becomes one more piece of a pattern that's worth having checked, rather than 9 separate, unrelated complaints. What tends to set this apart from ordinary winter dryness is that it often doesn't respond well to the usual fixes: thicker moisturizer, a humidifier, drinking more water, because the source of the imbalance isn't on the skin's surface at all. If you've cycled through 2 or 3 different lotions this year without much relief, that's a small but telling clue that this itch might not be an ordinary one. One quick note that matters more than any style guideline in this video: if you ever experience sudden, severe swelling, significant shortness of breath, confusion, or chest pain alongside any of these signs, that combination needs emergency medical attention right away. Please don't wait to see if it passes. This is different from the gradual, easy-to-dismiss pattern we've been describing throughout this video. Gradual fatigue over months is a make an appointment signal. Sudden shortness of breath or chest pain is a call for help right now signal, and the two should never be confused with each other. None of these 9 signs on their own means you have kidney disease. Fatigue happens, feet swell, sleep gets disrupted. That's exactly why each one gets dismissed, and exactly why so many people don't find out about kidney damage until it's already progressed. What matters isn't any single sign in isolation, it's the pattern. If 2, 3, or more of these have been quietly stacking up in your life over the past few months, that's meg gear in nose and getting way the laud or manicatable. It's worth a conversation with your doctor and a simple blood and urine test, which is the only real way to know what's happening inside your body. Kidney disease caught early can often be slowed significantly, which makes this list less about fear and more about giving you back some control. So here's what I'd ask. Think back through these 9 signs, and if even one of them sounded familiar, drop a comment below and let me know which one caught your attention. Sometimes just writing it down is what finally pushes someone to bring it up at their next appointment. And if this helped connect a few dots for you, subscribe, because there's more where this came from. Your body has been talking. Now you know how to listen. If you want to make this practical, here's the simplest version. Over the next few days, mentally walk back through fatigue, sleep, urination, swelling, appetite, cramps, and skin, and notice honestly whether any of them have been quietly present for weeks or months, rather than just a single bad day. You don't need to diagnose yourself, and you shouldn't try to. What you can do is walk into your next doctor's visit with specifics instead of a vague, I know just been feeling off lately. Specifics are what turn a 5-minute checkup into an actual conversation, and an actual conversation is what leads to the simple blood and urine tests that tell you what's really going on. That's the whole goal of this video, not to hand you something to be afraid of, but to hand you something to act on.